What have we learned from COVID in the 2 years that we've been suffering through it? Roman Baber is an NPP in Ontario. He joins me right now. You're not a doctor, you're a lawyer, but you are a legislator. And some people are saying that aside from the virus, government as an institution has not learned what it should learn. What should government have learned over the last 2 years, and what should it be doing now?
Well, the name of the game is hospital capacity. And
yes.
Doug Ford has failed to do the very thing that he needed to do most, which is build up Ontario's hospital capacity. We have less capacity now than we did before the pandemic. But most importantly, we are artificially choking capacity by the fact that we removed unvaccinated healthcare workers, by our very strict isolation protocols, and we're not compensating. We're capping pay at 1% by virtue of Bill 124, and nurses are leaving the system.
So we don't have the capacity we did before, Roman, and people over the last few years have said, both in hospitals and in old age homes, we should be increasing capacity, not only from a personnel point of view, but from a bricks and mortar point of view. Why hasn't government been doing that?
Well, mostly mismanagement. But it's not a brick and mortars issue. It's a staffing issue. And we're seeing that government is now artificially creating the challenges that, in fact, led us to this place.
Why?
Ideology, I think, is the answer. Cancel culture and political correctness that have driven mostly the response to this virus have forced hospital administrators to get rid of thousands of unvaccinated healthcare workers. COVID isolation
protocol. Do you want an unvaccinated healthcare worker dealing with a person who is 80 years of age and not in great health?
Well, we now learn from the chief medical officer that Omicron transmits among fully vaccinated individuals. And so they are almost as likely to pass Omicron as their vaccinated colleagues. And so even Dr. Isaac Bogosh a week ago suggested that we should bring unvaccinated healthcare workers, given the strain we have on the system. And there's nothing wrong with testing them daily. We need every available resources. Like the Premier says, all hands on deck, let's get all hands on deck.
I want to clarify one matter because a number of people have called you an anti-vaxxer. Is that correct? Are you an anti-vaxxer?
Well, look, I'm pro-voluntary vaccination. That's why I'm vaccinated myself. But I think that we should not be forcing anyone to do anything against their will. We've never done that before. We now know that the virus transmits among vaccinated individuals as well. And so
you say vaccines are useless?
I never said that. Clearly, they have an effect in preventing bad outcomes. But in terms of keeping each other safe from transmission, it appears that their efficacy completely waned. And so the argument for passports and mandates is no longer on the table.
3 minutes, Roman Baber. Thank you very much. Thank you very, very much for watching and for engaging in the 3 minutes, which will carry you through most discussions for the day. 2022 is going to be a very, very tough year. Stay with us. Please tell your friends to subscribe and PayPal. Thanks.